I'm Montica Wilson. This is for spring 2026 head to toe exam for Dr. Powell. Let's start off by scanning the room. My patient Ayana, ceiling, and the floor, and equipment. All right. For patient privacy, we've already assessed the anterior, posterior, skin, chest, and abdomen. It is free from bruises, lesions, nevi. The skin turgor is elastic. The temp is warm. It's dry, and it's intact. We're gonna start off with the head. The head is normal cephalic, and I am going to palpate. All right. The hair is evenly distributed throughout. It's coarse. It's natural color at the root. There's no sign of infestation. There's no depressions. No nodules or masses. We're going to assess cranial nerve number 7. Facial, can you smile for me? Frown. Puff out your cheeks. Puff your lips. All right, cranial nerve number 7 is intact. Next, we're going to assess for cranial nerve number 5. Can you open and close your mouth? Close it. Clench your cheeks. All right. And now we're going to assess for your temporal arteries. Palpate them. All right, they're 2+ bilaterally. And now we're going to do eyes. The hair, we're going to assess the eyes, the eyelashes, eyebrows, and the palpable fissures. We're going to have you look up for me. All right, the sclera is white, the conjunctiva is pink. I don't see any discharge or anything of that nature. And now we're going to finish assessing the eyes with the eye exam. I'm gonna get you to read that last line, cover your right eye, excuse me. Read that last line for me.
LTFPH.
All right, cover your left eye, do the same.
LTFPH.
All right, and you can just do both eyes.
LTFPH.
All right, and that's 20/20 bilaterally. And now we're going to assess peripheral vision. Can you cover your right eye for me? All right, and tell me how many fingers I'm holding up.
1, 2, 1, 2.
All right, other eye.
2, 1, 2, 1.
All right, peripheral vision is intact. And that's cranial nerve number 2 is intact. And now I'm going to check for perla as well as accommodation and convergence. Right, stay looking ahead for me. Pupils are equally reactive and round and reactive to light accommodation. I need you to follow the pen for me. All right, and convergence is intact. And now we're going to assess. We assessed the eyes. Now we're going to move to the nose, and this is going to be assessing for cranial nerve number 1. Olfactory. Can you cover one of your nostrils for me? All right, close your eyes. All right, tell me what you smell.
Alcohol.
All right, cover your other one. What do you smell?
Alcohol.
All right, and now we're going to assess for lymph nodes. We're going to start with the preauricular, postauricular, occipital, tonsillar, submandibular, submental, anterior cervical, posterior cervical, supraclavicular. And there's no nodules, no tenderness noted there. We are going to assess for, your mouth. In the mouth, we're going to assess the teeth, the tongue, the soft palate, the uvula, and tonsils. All right, can you open real big for me? Say ah. All right, and that's also assessing cranial nerve number 10. The uvula and soft palate rise with phonation. The teeth are intact. The buccal mucosa is moist and pink. Now we're going to stick your tongue out for me, and we're gonna kind of make it do a dance. Point it to the right, left, up, down. Hyperglossal is intact. And now we're going to do, we did the ears, whisper test. I'm gonna cover one of your ears and you tell me, repeat back those words to me.
Office. Chair. Dog. Cat.
All right, now we're gonna do the Weber's test for lateralization. I'm gonna stick this in the middle of your head and you tell me if it sounds equal on both sides.
Yes.
All right, now we're going to do Renee's test, and this is air conduction versus bone conduction. And you tell me which sound is better, the first or the second. All right.
Second.
All right, air conduction is greater than bone conduction. And now we're gonna do light sensation. I want you to close your eyes for me and you tell me where I'm touching you.
Tip of my nose. Forehead. Cheek.
All right, and now we're going to palpate your sinuses, frontal, maxillary. All right, and we have done. We're going to do the inner ear. We got the otoscope. Excuse me. All right. Okay, the auditory canal is clear, and the tympanic membrane is a pearly gray. And I'm going to take a look at your inner eye structures as well as your optic nerve with the ophthalmoscope. Take a look at me. I'm sorry. All right, and the optic nerve is intact, round with sharp disc margins. The arteries and the vessels in the eye are intact. There's no narrowing noted. And now I'm going to check the 6 areas of gaze. I just need you to follow this for me. Okay, the 6 areas of coronal gaze are intact. That means 3, 4, and 6 are intact of the cranial nerve. And now we're going to assess, we did the ears, the mouth, the nose, and now we're going to do the neck. The neck is midline and supple. All right, I'm just gonna palpate your trachea. Trachea is midline, and now I'm going to get you to, I'm gonna push this to the left, your trachea to the left. Swallow for me. All right, and to the right, swallow again. All right, the thyroid is non-palpable. And now we're going to move on to respiratory. Can you turn with your back towards me a little bit? Now we're looking for any signs of respiratory depression. There's no accessory muscles being used. There's no tripoding, no nasal flaring. So we're going to go ahead and check for equal chest rise. Can you take a deep breath for me? Okay, and it rises equally. Now we're going to check for tactile fremitus. I want you to say 99 with each touch.
99, 99, 99, 99.
All right, the vibrations are equal bilaterally. And now we're going to percuss in each area, in our intercostal spaces. All right, resonance heard throughout, and now we're going to auscultate for lung sounds. Take a deep breath with each touch. All right, now we're going to check for egophony. I want you to say E with each touch.
E, 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 E,
All right, now we're going to check for bronchophony. I want you to say 99 with each touch.
99, 99, 99, 99, 99, 99, 99, 99.
All right, now we're going to check for whisper pectorality, and now we're going to whisper 99 with each touch. Okay, and now we're going to turn around. I'm going to listen to your front. Make sure your chest rises equally. Can you take a deep breath for me? All right, I'm going to check for tactile fragmentus. Say 99 with each touch.
99, 99, 99, 99.
All right, vibrations are equal bilaterally. And now I'm going to auscultate the lungs. Take a deep breath with each touch. All right, lungs are clear to auscultation, and now I'm going to listen to heart sounds. I'm going to start with my diaphragm. All right, aortic is right sternal, mid-sternal, second intercostal space. Pulmonic, left sternal, second intercostal space. Earth's point, third intercostal space. Tricuspid is the fourth intercostal space, and then mitral is midclavicular, fifth intercostal space, and this is the point of maximum intensity. And we're going to listen to apical pulse for 1 minute. All right, and now I'm going to listen with the bell of my stethoscope to the same points: aortic, pulmonic, Earth's point, tricuspid, and mitral. All right, S1 and S2 were heard. There's no extra heart sounds. No extra heart sounds were heard. And now I am going to get you to lay down for me. All right. And we're gonna be checking for JVD. I'm gonna get you to sit up 30 degrees for me and turn your head to the left. All right, the sternocleidomastoid muscle is flat. There's no pulsation, so JVD is negative. All right, you can lay flat for me. I'm inspecting the chest. There's no lifts or heaves. And now I'm going to palpate in those same points. And we're going to start with aortic, pulmonic, Earth's point, tricuspid, and mitral. All right, there's no thrills noted. And now I'm going to auscultate with my diaphragm first. Aortic, pulmonic, Earth's point, tricuspid, and mitral. Now with the bell, aortic, pulmonic, Earth's point, tricuspid, and mitral. Okay, S1 and 2 are heard throughout. There's no extra heart sounds or gallops noted. Now I'm going to listen to the arteries. I'm going to start with the aortic artery. Aortic, iliac, renal, and femoral. All right, now we're going to assess the abdomen. Upon inspection, it is flat, symmetrical, no masses or anything noted. Then we're going to percuss the abdomen. I'm going to listen to bowel sounds first. Excuse me. I'll auscultate with the diaphragm. Starting the right lower quadrant, right upper quadrant, left upper, and left lower. All right, and now we can percuss the abdomen. All right, resonance heard throughout, some dullness over the liver. I'm gonna get you to hold your breath for me. All right, and the spleen is not enlarged either. Now we're going to palpate. Okay, no tenderness or mass is noted on palpation. Now we're going to listen to this. All right, we're gonna sit back up. You just sit down for me. And now we're gonna do musculoskeletal. I'm gonna start with the upper extremities, the hands, the elbows, and shoulders. Looking at upon inspection, they're symmetrical. There's no masses or nodules noted. I'm going to palpate. All right, no crepitus or tenderness noted, and we're going to start with, we're going to assess for graphesthesia and sternosis. Okay, can you close your eyes for me? All right, hold out your left hand. I'll put this in. You tell me what this is.
Rubber band.
All right, open your right hand. You tell me what this is. All right. Sternosis is positive, and now we're going to do graphesthesia. Let me see your left hand. I'll write something in there and you tell me what it is. T. All right.
B.
Okay. All right. Graphesthesia is positive. And now we're going to, you can open your eyes. Well, actually keep them closed. I'm sorry. We're going to test for a light sensation. You tell me where I'm touching you.
Forearm. Ankle. Chin.
All right. Light sensation is intact. Now we're going to check for, you can open your eyes and do a cap refill on your fingers. All right. Cap refill is less than 3 seconds bilaterally. Now we're going to check for range of motion in your fingers. I'm going to get you to do flexion, extension, hyperextension, abduction, adduction. All right, and fill range of motion is noted in the fingers. And can we do finger opposition? Thumb opposition, excuse me. Just that one, yeah. Okay. And now we're going to do the same thing for your wrist. Can you do flexion, extension, hyperextension, circumduction? All right, full range of motion for your wrist. Now we're going to do your elbows, flexion, extension, hyperextension. Shoulders, we're going to do flexion, extension, hyperextension, adduction, abduction. All right, full range of motion noted for your shoulders. And now we're going to check for strength. Just squeeze my hands for me. 5 out of 5. Hold your arms up like this. We're going to try bicep and tricep strength. Pull. 5 out of 5. Hold your arms out like this. This is shoulder girdle. Push up. Push down. Okay, strength is 5 out of 5. And now we're going to check your deep tendon reflexes. I'm sorry. Other side. I forgot I had my blade away. All right. Relax it for him. All right. All right. And then we're gonna do patella. Can you scoot back some? All right. All right. And Achilles. And then Babinski's reflex. All right. And those are deep tendon reflexes are intact. And now I'm going to check the cap refill in your toes. All right, those are 3 plus bilaterally. I'm gonna check your pulses. The sounds, Peters. All right, and those are 2+ bilaterally. And then we're going to check the strength in your bilateral extremities. Can you push up for me? All right, and then push out. All right, hip strength, out, in. All right, and your feet, can you push down for me like you're driving? All right, and push up. All right, strength is 5 out of 5 with the ankles, knees, and the hips. I'm gonna get you to, I feel like I'm missing something. All right, can you stand up for me? We're gonna do some range of motion on your bilateral lower extremities. I'm gonna start with your hips. Let's do the knees first. Let's do flexion, extension, hyperextension. All right, flexion, extension, hyperextension. All right, now we're gonna do our hips. Flexion, extension, hyperextension. No, sorry, I did that wrong. Flexion, extension, hyperextension. All right, circumduction. Yeah, there you go. And then inversion, exversion. All right, now we're gonna do the other side. Flexion, extension, hyperextension, circumduction. All right, and then you got inversion, exversion. All right, so the full range of motion on your hips. And then we're going to assess, your spine. All right, any soreness on palpation, and the shoulders are symmetrical, even, and there's no the symmetry. There is symmetry. And I'm gonna get you to bend a little bit, just 30 degrees right there for me. The shoulders remain equal. There's no scoliosis or kyphosis noted. And now I am going to do, this is flexion, extension, hyperextension, and then we're gonna do lateral. All right, that's good. Now we're gonna do your cervical spine. And you just put your head down, this flexion, back up, extension, all the way back, hyperextension, and then you're gonna do circumduction and lateral for me. There you go. All right, full range of motion noted in the cervical spine. And now we are going to get you to walk towards the camera and walk back. All right, hold your hands out and close your eyes. All right, there's no swaying noted, so Rumberg sign is negative. All right, you can open your eyes for me and now walk towards the camera, heel toe, heel toe, heel toe, heel toe, and back. All right, hop on your right foot for me, left foot. All right, that completes my head stuff. Thank you.